appreciate this opportunity. I started my program back in September 2017 in the Interdisciplinary Health Master's Program. And so I've been working on this study more or less for the last 2 years. And look forward to telling you guys a bit about just the research globally, nationally, and then our particular study is the big focus of the discussion. So a bit of background, back in 2006, the National Aboriginal Health Organization wrote a discussion paper just focusing in on how there is in Canada and internationally a lack of research in Indigenous occupational health and safety issues. There's different pieces of the puzzle, like there's research on employment, there's some research on injuries, but there's not really a connection to the occupational health and safety piece of the puzzle. So their recommendation back in 2006 was that research needs to be done on both what injuries, like what types of injuries, experiences, illnesses are happening, as well as what policies could be put in place to make the conditions better and improve the occupational health and safety situation. Since then, there's been a little bit of research out in BC for the most part. So Horn and Johnson wrote a discussion paper in 2008 on a study that they'd done. They went and interviewed business owners, Indigenous business owners in British Columbia, mostly in the construction sector, but in a few different sectors, and tried to get their perspective on how the occupational health and safety situation was and what could be done to improve it. And for the most part, their recommendation in 2008 was that there be more of an interface between WorkSafe BC and helping Indigenous communities translate some of the things into their own specific circumstances and situations to better use the existing policies. And then in 2012, there was a study done by Langlois et al., and they focused in particular on just emergency fire and safety crews in BC. It was also a qualitative study where they interviewed and took surveys from the individual workers and tried to get a sense of what the injuries and illnesses were, and also what are ways that those could be avoided. Other than those two studies, there hasn't really been much done in Canada to this point. I'll discuss our research and I'll discuss a bit of the other research that's ongoing, but it's really kind of a wide open field at the moment. And then in the last paper I'll mention for Canada is in 2016, the National Collaborating Centre for Aboriginal Health sort of did a paper that more or less follows up on the National Aboriginal Health Organization paper, still showing that there's not a lot of research out there focusing in on the employment piece, education piece, but not a lot of occupational health and safety information to build on. Out of the 12-page paper, they only had about a page maybe on occupational health and safety issues, and most of those were pulled from papers that weren't really focusing on occupational health and safety. They sort of mentioned them, but it wasn't the main focus. So the main focus of this study and the reason for doing it is that occupational morbidity and mortality improvements over the past 50 years have not been distributed equitably between social classes and racial and ethnic groups. Although this hasn't really been researched in Indigenous groups, there is literature in the US on Black and Hispanic groups, and in Canada there's been a bit on immigrant occupational health and safety. So that's where it stands at the moment. And also there's a focus on individual exposure and variability affecting health risk. And that can be a problem because complex social issues linked to race and ethnicity can be neglected. As important as all of those individual exposure and variability aspects are, there needs to be a connecting piece for some of these other groups that may not always be properly dealt with. I'll quickly go over some of the international research. Again, there hasn't really been much. It's a handful of papers in Canada and a handful of papers internationally. In Australia, a few different researchers looked into this 20 years ago, but then there hasn't been too much since then. They were comparing Aboriginal and Torres Strait Islander occupational health and safety to the rest of the Australian population. in the US, there's been a bit of research on Navajo farmers. That's pretty much the extent of the Indigenous occupational health and safety research in the US. And then in New Zealand, there has been some more recent papers and some more focused and interesting directions where this one paper, Ethnic Differences and Patterns of Occupational Exposure in New Zealand, where they were actually comparing the general population of New Zealand to Maori groups and finding that there was these differences even within certain occupations. There was differences even within the same job title. There was still differences in occupational health and safety outcomes. And then another paper that I just want to mention because it was took an interesting look at collectivism, cultural identity, and employee mental health. That was sort of a mixed qualitative, quantitative, trying to survey employees and find out how much of a connection they had to their culture and their collectivism and how that would connect to the mental health. And they found that it did have a positive interaction. So focusing back in on Canada, there's two organizations at the moment that have come about relatively recently. The First Nations Safety Council of BC was founded in 2015, most likely as a result from the recommendations of the Horn and Johnson report and the Langlois report, which were both funded by WorkSafe BC. And then more recently in Saskatchewan, there was an organization founded in 2016, which just changed its name in December of 2019. And it's now, instead of just having a focus on Saskatchewan, it's focusing on Canada-wide, the Indigenous Center for Occupational Health and Public Safety. So that's good to see. So now focusing on the particular study that I've been a part of. Back in 2016, the study was proposed by Dr. Mino-nokiiwin and Dr. Lightfoot, and letters of support from 4 different communities were received. In January of 2018, Ministry of Labor funding was received. We had a meeting or a little gathering right here when that was received. And then in the spring of 2018, we began going back to the communities that had expressed interest initially, confirmed their interest, and went forward with focus groups in the fall of 2018. In the winter and spring of 2018-2019, we undertook the transcription of all those focus groups and undertook a thematic analysis of them. And then in this past fall and winter of 2019, we returned to most of the communities and taken the themes that came out of the focus groups and just went back to confirm if this is what they've been intending to communicate in those focus groups. And then going forward in the next month or so, we're finishing up reports both for the general public and also specifically for the communities to get some recommendations and to get some of the feedback from these meetings. So just a quick point on our methods. The overall methodology of the study was community-based participatory research. So we had a steering committee with representatives from each of the communities that would guide the research along the way so that we're not just trying to come in as researchers, as much experience as Dr. Mino-nokiiwin and Dr. Lightfoot have. We don't want to impose just an academic top-down process, but also have the communities guide the process along with the academic side of things. Focus groups were used. It was 2-hour focus groups. The smallest one was 2 people. The largest was 10. We were aiming for around 6 in them. That was the average between the 4 focus groups. And we undertook Braun and Clark's thematic analysis to look at those transcripts. So the study objectives of the Mino-nokiiwin project were to determine the occupational health and safety experiences of Indigenous workers from 4 Northwestern Ontario communities from the perspective of community members, focusing on illness, injuries, current initiatives and policies, the knowledge of WSIB and the compensation experience, and what ideas for future research might come up. And I'll quickly read through the focus group questions before we get into some of the quotes that came out of the focus groups. The focus group questions were very much of a general guideline, but we didn't follow them closely as the discussion ranged quite a bit in between each of the questions. These were the general categories. What types of work-related health issues and injuries do you see in your community? Do you have any occupational health and safety concerns in your community? Have there been any types of occupational health and safety training available in your community? Can you tell us the employers in your community with occupational health and safety procedures and policies? Do people generally know they can make a WSIB claim and how to do that? And would there be any interest in collecting current and longest job titles to help identify potential health outcomes of concern? So just to go through some initial impressions before we get into the thematic data. From going to all these communities, it was clear that the band administrations, things are going quite well. They've got lots of policies and procedures in place. The WSIB experience is very good within the band administration. Everything is processed very quickly within the short time frame that's required. And in regards to that side of things, the band administrations in particular, which was, they were represented on almost all of the focus groups. So just to point out that side of things, apart from some minor policy things and things that can be pieces of the puzzle that can be fixed, the overall picture is very good to see. The one issue was looking into the area of small businesses. There was definitely more gaps in that area as far as just not being registered with WSIB, not necessarily even doing any deductions whatsoever for EI or any of that, which can leave the workers in a precarious situation if anything it does happen. And then gray area, just to mention that because of the jurisdictional issues with First Nations reserves being sort of caught between the federal and provincial policies to some degree, there are issues that just the general occupational health and safety policy can't just be brought in without modifying it to fit the particular needs of each community. So the themes that were developed from the focus group data, and then in conversation with the steering committee and going back to the focus groups afterwards, the mental health experience, impacts of lateral violence, the compensation process, understanding your rights, policy development, and employer support for occupational health and safety policies. So I'll read through these quotes and then we'll discuss it a little bit. The mental health experience. I'm working with communities right now, and you could be working with someone 1 week and then they're gone. And so I'm seeing that it's pretty common turnover, especially in the social work field. So it's just, it's a tough field in terms of mental health and your own well-being. How do we deal with customers that have these mental health issues? What you realize is that your own wellness is the most important thing. They always talk about before you take care of your friend, you need to take care of yourself. And it just, that really applies there. This theme came out as very important because there was a discussion of some of the physical occupational health and safety issues that came up, but for the most part, there wasn't any overwhelming correlation between the four communities. There was just some slips and falls and various injuries that happened in different occupations, but there wasn't a clear theme across the communities. But with the mental health experience, it was something that all four of the communities brought up, especially in regards to working in the social work field and healthcare field and even in administration, that there isn't always the supports there that are needed to help the workers deal with things and not get to the point where they either can get burned out or just become apathetic, in some of the focus groups discussed. And so that was definitely one of the key things that we came across. Number two, impacts of lateral violence. Now I'm aware of it and I'm conscious of what it is. Yeah, it's like bullying amped up, and yeah, it's hard because I feel like our communities are, still undertaking healing, and sometimes we take it out on our own people. I used to think a lot about where this lateral violence comes from, and I've seen it. I'm not an expert, but I will say, I think one of the sources that it comes from is starting to believe in the Native community. It's when you start to believe what, let's just say, the system and the mainstreams have been telling you, that you have nothing to contribute, that you're just a pain. This theme as well clearly came up in all four of the groups without, it was brought up from the groups. We didn't bring it up in any questions. The good thing is, in regards to this theme, all of the communities have had lots of training courses and are well aware of the issue and are taking a lot of steps and doing regular training to counteract the issues that arise from lateral violence. But there's definitely still room to do more research into the effects of it, and as well as how to deal with these effects in the communities. The compensation process, understanding your rights. You're an employee, but you don't have enough knowledge on how to proceed. Okay, I just got hurt. I just got told to take a few days off, come back when your back's better. Well, that's not the answer. I've heard more than once about people who continue to go to work with an injury because they don't want to lose their job. Now, this is, as I mentioned before, within the band administration, all the WSIB and EI and all of that sort of thing is taken care of very well. It's talking more about the small businesses, the construction companies, and workers on and off reserve, that even though there's regulations and the WSIB and the Ministry of Labor has the regulations to make sure workers are aware, there are still these gaps that need to be addressed so that all workers are aware of their rights and know how to avoid the injuries, how to avoid unsafe work, and how to get the proper care and get the proper compensation. And that's one of the big areas to look into going forward. Is a lot of the workers might just fall back on disability or welfare when they could very well be entitled to, or they should be entitled to, the WSIB benefits or the EI benefits or the long-term disability benefits that would actually be paying much, much more and providing them a better standard of living. But sometimes the hoops and the paperwork just aren't easy to negotiate, and that's an area that definitely needs to be looked into going forward. So policy development, mostly in terms of the band administration policy, but also in terms of how that band administration policy can interact with the small businesses in the community as well. I'd also like to see a recommendation where it comes that any businesses on reserve have WSIB. A lot of safety issues are not followed because there's nobody to enforce that safety issue. I remember looking out the window and looking at a guy who was on the roof next door with running shoes, no hard hat, nothing. And I turned to one of the girls and said, "Who's that over there?" And they said, "Oh, that's one of the workers." And I said, "Where's his safety equipment?" And I said, "Why is his life worth less on reserve than it is off reserve?" And something that came up in the groups, and something that again goes back to that jurisdictional issue. It was mentioned that at one point the Ministry of Labor was called by an employee, and they called the chief and talked to some of the administration before they came on reserve because they didn't want to step over any of those lines. But that does provide an issue because there isn't necessarily anything to fill their place. If they, in that case, they were granted permission, they came in, they investigated the issue, it was sorted out. But aside from the Ministry of Labor coming in, there's not necessarily the funding or the personnel to cover that issue, to look into these gaps in occupational health and safety standards and make sure that they're enforced. So there is workers that are still working less safely than they might be, especially since the Ministry of Labor has been cracking down so much just in Ontario over the past 5 years. It's not necessarily translating over onto the reserves. Another theme, employer support for occupational health and safety policies. And this is focusing more on small businesses. They've been trying to deal with the Canada Revenue Agency, and it's just a big headache with them, especially for small businesses. I mean, that's why I feel like they just kind of push that onto young staff. Hey, you don't have to, we can pay you under the table. We've got to be on top of the process, and that's where I'm stuck in the paperwork also. Just, this store has been there for 50 years, and I've been there for the last 3. And I'm like, so we are a growing community and always have been. Just in the last short while, we've had a huge amount of growth. It's incredible. But with that growth, we've kind of got left, certain processes got left behind. It's just the nature of working, within the Indian Act and things like that. There's just sometimes a disconnect, sometimes extra process, or the process is just not there. And so as I was mentioning, there does need to be, going forward, some kind of a way to help these smaller businesses and the employees gain the awareness that how much protection it provides for the employer and the employee when they are registered for WSIB, when they are, even though they're not required to be taking off income tax, taking off those other programs. A lot of people don't see the benefit. They just think the cash might be easier if they're a not well-educated or unskilled worker working at a small construction business or a small retail store that wants to do things under the table. But that's definitely an area that needs to be worked with forward, moving forward to bring that education. So those are the 5 themes. In closing, it's really good to see the progress that has been attained, that there is starting to be more research. At the same time that we were granted research in January 2018, there was also an initiative, Mino-nokiiwin, We Are Living Well Health and Safety Initiative in Thunder Bay. There was also granted money by the Ministry of Labor. And so I'm looking forward to reading. They've released some pamphlets and some worker information. I'm looking forward to seeing what kind of research comes out of their initiative. And I'm aware that there's also some researchers in Saskatchewan. I've heard of some stuff in Manitoba, but I haven't really been able to track down anything that came out of that research. But just in closing, to talk about the Indigenous population of Canada have a lot of a younger demographic than the general population. And I've also read some research that shows that there's a lot more self-employment that's been happening in the past 5 years or so as well. So with those things in mind, it's definitely important to pursue more of this research in order to make sure that the occupational health and safety benefits that are coming to the rest of the province, the rest of the country of Canada, are also distributed and brought in a culturally sensitive way to the Indigenous groups as well. So I'd just like to acknowledge and thank my supervisor, Dr. Nancy Lightfoot, and Dr. Daryl Manitowoc, who's part of my thesis committee and both co-PIs for this research project. The steering committee, Jeff Moulton, Carmen Nuchitai, and Mary Lynn Ojig. We also want to thank the Ministry of Labor for obviously providing the funding so that we can do this research, and CROSH as well. We want to thank CROSH for the use of different resources over the past couple of years as well. So is there any questions?
Awesome, thank you, Nate. I thought that was pretty interesting, like eye-opening for sure. We have a couple questions online, and then we'll get to some other questions here too. First one here, was there any collaboration with the Mino-nokiiwin Tribal Council on this project?
No, that was what I mentioned at the end. They received some of the funding for that other project up in Thunder Bay. So I've been kind of following it. We haven't collaborated with them at this point, but definitely something to consider once their research and ours begins to publish some reports.
I was thinking too, it's a big point with the small businesses, how they may not have a lot of these processes in place, and just even the information or the resources to get things done properly, and so you see working under the table and all that. But I'm thinking about even just like the large businesses and big corporations, think about the mining sector. A lot of times they have their operations on Indigenous land. There are a lot of, there's an agreement that, a large portion or a small portion of their workforce are to be Indigenous people. Even just from speaking to I can think of one place in mind that we visited. One of the big issues, again, and you mentioned it, was the turnover and keeping the workers and keeping them either safe, keeping them, wanting to work for them. And is there any recommendations, or is there anything that maybe came out of this that we can do to improve that and make those working conditions better for them, keep them working? It seems like it's just a big issue.
Yeah, at the moment, the biggest thing, my takeaway is the worker awareness. Because the small businesses can be provided with things, but there was actually some workers for small businesses in some of the focus groups that were really advocating and saying the workers need to get the information and then be able to speak up and advocate for themselves. It's not just going to be a simple solution of getting things at the band council and at the administration and the owners of the businesses, but also getting all those workers, not just that little 4-step like worker awareness thing, but actually having them really understand that they do have the right to demand that they have a safe workplace and that sort of thing. So I think that's the important piece of the puzzle for that going forward.
Another one online, first saying great presentation, good work on the project. They're wondering if you can comment on how the issues of rurality or remoteness intersect with some of your findings, and what can be done to build capacity or support delivery of services within those Indigenous communities.
The communities we worked with, none of them were really remote. The paper that I mentioned at the beginning, I would definitely recommend looking into that National Collaborating Center on Aboriginal Health, the 2016 paper, because the remoteness was a big piece of the puzzle in their paper.
Okay.
He didn't I'm definitely looking for more research on that, as it's definitely with the distribution of Indigenous groups in Canada, it's a big thing to look into, but our particular project didn't necessarily address it too much.
Okay. Are there any questions here in the room?
Maybe I'll build up that last one sort of with remoteness, but with the territories, because they have much larger indigenous population than we do. How do they deal with health and safety? Like, do we have any research on knowing what
I haven't been able to find it, no.
Okay.
Like, for the most part, almost all the research that I initially found, other than papers that kind of tangentially mention Indigenous occupational issues, I haven't really seen much on the territories, so perhaps there's something in the works with that as well, I would hope, but
do you think the populations up there are sort of bigger and would probably be dealing with better?
Yeah. There might be some things published, but just not academically, or some reports that I haven't been able to come across yet.
I have a question. You mentioned the Thunder Bay group was working on some pamphlets and such, and given the oral traditions of Indigenous people, what are you planning to do for dissemination of some of your stuff?
Well, we are planning on the traditional written form of reports back to the communities, but we have been discussing that, perhaps trying to do something with social media. We are planning to do another meeting back to the community to present it, but again, like, those sorts of meetings might not get that much of a response, so it might be more in terms of the social media that we try to get that angle.
Challenge for sure.
Yeah.
Great, I think that's it. Well, thank you so much again, Nate, for your presentation, for being here today.